So believe it or not, 5 years ago this week, the pandemic started shutting down our country and millions started working from home to prevent the spread of COVID-19. More than 7 million people around the world have died from it. And even after all of this time, some people are still feeling the negative effects from the virus they contracted at the beginning of the pandemic. Our Melissa Wilson caught up with a patient from New York City, America's Ground Zero, who suffers to this day from long COVID.
COVID fatigue. This is what COVID fatigue looks like. Totally immobilized.
God, I never knew this was going to be this hard.
Alex Blanco knows the feeling. His life changed forever the day he was diagnosed with COVID-19 in January of 2021. It seriously damaged his heart, forcing him into open heart surgery.
I've had additional COVID infections since, and then in the summer, it kind of affected the heart again with what they call AFib, atrial fibrillation, and I ended up having to have another procedure in October. And I still use oxygen, from scarring in the bottom part of my lungs.
Alex is one of millions who continues to suffer from long COVID. He helps others through awareness in an online support group and through this long-haul movie produced by his doctor's office, Pulmonary Wellness. The condition causes symptoms that just won't go away for a month or even years after the infection is cleared.
I would like to get back to work, but it's, the long COVID symptoms are not easy, from the breathing issues to there's a lot of vertigo, nausea, fatigue. Minimal exertion will cause severe fatigue and the brain fog has been terrible.
Alex is far from alone. The Centers for Disease Control and Prevention says at least 18 million others suffer from long COVID. Let's take a look at the numbers. Women are hit the hardest at 8.5%, men falling down to 5%. Kiddos, very few get it at only 1%. Now, as far as who is suffering from it, older adults usually get those symptoms the worst. Only 4%, though, getting long COVID. Finally, the group hit the hardest, ages 35 to 49. These are the majority of people who get long COVID.
The people that I've found that have had the worst outcomes and who are still suffering the most are the people that got sick early on. So
Dr. Noah Greenspan is Alex's specialist. He works at a center that specializes in rehabilitating patients with debilitating symptoms.
My heart breaks for Alex because, it's like you're talking about people who are leading completely normal, healthy lives, going to work every day, taking care of their children every day, doing this, doing that, playing sports, going out to entertainment, and then their lives completely change to where, even sometimes the slightest activity or the slightest overexertion is enough to put you back in bed or is enough to flare your symptoms.
Dr. Greenspan admits it's challenging to treat long COVID because it impacts every patient so differently. He encourages starting with only 2 minutes of exercise and work out from there. Other key elements?
Number one is compression, okay? And by that, I mean like compression garments, stockings, leggings, and hose, because there is, something related to the autonomic nervous system where blood pressures are off or disproportionate to the activity or the position that you're in. Heart rates are off. Electrolyte supplementation and fluid supplementation has been very, very helpful to people. Resting when you need it and, really balancing activity and exercise, with rest and restorative activities. And the last thing that we do that we found very helpful is we use oxygen therapy for patients.
It's helping Alex, and Dr. Greenspan says he wishes more people would try oxygen. Support groups can help the mental aspect of it all, too, spending time with others who get it.
I hope that getting the word out there kind of reminds people that we may be past the pandemic, but there's still a lot of people, with long COVID. And, I hope we're not forgotten because we still need a lot of help and support.
Alex is always encouraging others, which ends up helping him.
Don't give up.
No matter how bad it gets, no matter how dark it gets or stormy it gets, don't give up. Keep putting one foot in front of the other. Keep taking one breath after another. Thank you all.
Melissa Wilson, Fox 26 News.